Here's what no one told me during orientation. Delegation isn't just about getting help, and it is certainly not about dumping tasks on your coworkers, but it is about protecting your patients and your license. If you don't know the five rights of delegation, then you may already be making risky calls. My name is Jessica Smith Dos Santos. I've been a nurse for 20 years, and I have the pleasure of mentoring a lot of new grad nurses. And when it comes to delegation and teaching that skill, all of my new grads are very uncomfortable because number one, they still feel like they're learning and they want to do the task to support their learning. But number two, they don't feel like they've earned the right to be able to delegate. And here's the thing about that mindset, it can be very dangerous and it can set up a new nurse to get so far behind that it puts your license and your patients in danger. So I'm here to share with you 6 tips on how and when to delegate so that your patients are protected, you are protected, and you're leveraging the staff that they hired to support you with those tasks. So tip number 1, do you even know what can be delegated? I was talking with one of my new nurses and I was like, okay, I'm here to help you. What do you want me to do? And she's like, I have no idea. And I was like, okay, think about it from a perspective of there are only certain tasks that only the nurse can do. So, what are those tasks that only a nurse can do that nobody else in the department can do? And she started really thinking about it. And she came up with a really great list, actually. She came up with assessments. She came up with giving IV medications and pushes. And she came up with some of the charting aspects, which was great, but it wasn't complete. Also, nurses are the only ones that can do patient teaching. So think of it from a standpoint of yourself as the nurse. And there are things that only a nurse can do, right? Assessments, teaching, IV pushes, and specific charting. So don't forget when it comes to those things, if you're running behind on those things because you're running around doing all of the things that you can be delegating, you're not staying in your lane and doing your job. You're trying to be a superhero or you're trying to prove yourself or you're just working too hard in general. Okay. So know what can be delegated and what cannot. There are things that only a nurse can do that can never be delegated. Pretty much everything else, like getting repeat vital signs, getting the patient a warm blanket, helping with hygiene, doing a Q2 hour turn, doing a glucose check. Those are a lot of things that take up a lot of time. Getting a glass of water, helping a patient get a warm blanket. All of those things can be done by somebody else who is there to support you while you catch up on the things that only you can do. A perfect example is the other day, I only had 2 patients, but I had just come off of an incredibly busy, like couple hour block. And my rooms were absolutely trashed, right? I had like 3 dirty rooms, and the IV cart needed to be restocked, and the patient in one of the rooms needed a warm blanket. Like there was all this stuff that needed to be done. But there was also charting that I needed to catch up on that only I could do. And another nurse who was not busy, who was totally caught up, popped over and said, hey, is there anything I can help you with? And I was like, actually, there is. If you could get that patient a warm blanket and start cleaning these rooms while I finish up my assessments and my charting from the previous patients, that would be awesome. Right. So he was able to support me with things that like all of our support staff can help us with so that I could stay in my lane and do the things that only I could do for the patients that I had been taking care of that day. Tip number 2 is assess and know the skills level and the scope of practice for the team member that you're going to be delegating to. So sometimes you're working with an unlicensed professional, or maybe you're working with an LPN, maybe you're working with a fellow RN. If a fellow RN comes over and you're like, hey, can you give that IV push? Rad, right? Like that's something that you can delegate because that team member has the license and the scope of practice to do it. And also like understand what's their level of skill. If they're brand new, they may not know how to clean a commode and put it back in the supply room where it belongs. They may not know how to properly like replace your suction or like how to properly discard of a medication bag with a little bit of medication left in it. So do you know, number one, their scope of practice? And do you know, number two, their skills level? Because those things are going to be really important. One of the things that I've discovered working in the ER is when I delegate vital signs, it comes with an expectation to report back to me. Like, I don't need to know if the commode has been put away. Like, you don't need to report that back to me, but I do need to know, what were that patient's vitals, and are there any concerns about those vitals? And does the person I'm delegating repeat vital signs to know when to report an abnormal vital sign, especially in a pediatric ER, because there are so many variations on what's normal depending on the age range. So just make sure that you know who you're delegating to, what their skill level is, and what their scope of practices, because it also puts your patients and your license at risk if you're delegating tasks that are outside of their scope of practice. Okay. Number three, use the 5 rights of delegation. Now, this is something that I heard like once in nursing school and never heard again. And I'm just kind of like making up delegation as I go. I felt like I was a freaking fish out of water because I was still new, and I was like, I still have to establish myself as a professional, like prove that I know what I'm doing and can handle a workload. And I have to develop that relationship with my staff so that I'm not sitting at the nursing station doing nothing and like dumping all my other tasks on them, right? So it's that fine line of like establishing relationship, establishing credibility, and knowing when and who to delegate to. So 5 rights of delegation are: the right task. Is it in their scope of practice? Do they have the skill set? Is it appropriate? The right circumstance. If I'm delegating something to somebody because I'm slammed, but they're equally slammed and they're not going to be able to help me, that's not the proper circumstance to be delegating, right? You need to be aware of what are the circumstances around delegation. Number three, the right person. Make sure it's in their scope of practice and that they have the skill level. And if you delegate something to them that is not in their skill level, are you prepared to support them to grow that skill so that they can become a better asset for you? Number four, communication. Be very, very clear on what it is that you need. And number five, does that task require any additional support or supervision? Sometimes like a Q2-hour turn can be delegated, but if it's a 450-pound patient, you might need to have multiple hands in there, or you might need to contact the lift team, or you might need to bring a specific piece of equipment to be able to do that safely. So 5 rights of delegation: right task, right circumstance, right person, right communication, and the correct supervision. Those are your 5 rights. So in the spirit of having clear communication, tip number 4 is be clear and specific. If you say, can you help me with the patient in room 5? That tells me nothing. Like, that tells the person who's supporting me absolutely nothing about what I actually need help with. Can you please go get a warm blanket for the patient in room 5 and a glass of water for the family member at the bedside? That is very, very specific. It's something that they can take action on, and help them understand exactly what it is that you need help with. If I delegate cleaning a room to a tech that's helping me, I will say, can you please clean that room? And by the way, there's IV bag in there that needs to be discarded properly, and we need to replace the suction, so that they're looking for those extra things that are outside of just wiping down cables and cleaning a bed, because those are things that we can miss in a busy environment, but they're also things that are really important to help keep our patients safe. So be very clear and very specific about what it is that you need your support person to do, when you need it done, and what your expectations are in terms of following up. Tip number 5, explain the why. So sometimes in certain circumstances, you need to provide the person who's supporting you with a little more information. Like, can you please go get a warm blanket for the patient in room 5, but don't cover up their left foot because they have a wound, right? Like, are we being very clear about what we need and how we need it done? If like you ask somebody like, hey, can you go stand with this patient for the next 10 minutes. And they're like, well, why am I wasting time in this room for 10 minutes? Can you please stand with them for 10 minutes? Because I noticed that their hallucinations are getting worse. And I'm working on with the charge nurse to get a sitter, but he's really unsafe. I'm afraid he's going to crawl out of bed and get hurt. Like, you're being my second set of eyes in this circumstance. So sometimes you need to expand on what it is that you need and why you need it. Hey, I need help turning the guy in room 6, but he's 450 pounds. Can you either gather some friends or call the lift team for me and let me know when everybody's ready so I can come help you? That is clear. It's concise. It helps them understand why you're doing it so that they're not watching you just like being on your computer and wondering why they're supporting you when you could go do it yourself, right? Like, there is that fine line between, is this nurse dumping tasks on me? Or does this nurse really need this help? So being clear about what you need and supporting that need with a why, like a deeper explanation as the circumstance calls for, will help build that rapport. It will help build that trust between you and your team member so that they know when you truly need help and when you ask and when you delegate, that it's because you truly need help and you're not just delegating to dump tasks. Last tip is tip 6. If you are not following up, then you are not delegating. You can't just delegate a task and not follow up to make sure that it was done. Always check back. Like, what was that repeat vital sign? Did you have any challenges switching out that suction? Hey, were there enough warm blankets in the blanket warmer for you to get that guy a blanket? Was the family member happy with their water? Was there anything else they needed in there? Having that closed loop communication eliminates options for assumption, and it also eliminates options for frustration and resentment. Because if you delegate a task and you ask for that help and you don't follow up to make sure that it was done, then it could set you up for realizing 30, 45 minutes, an hour later that the task that you delegated never got done because you didn't follow back up and close that loop. Sometimes there are circumstances where, God forbid, there's a code or the charge nurse prioritizes a different task for that tech that you didn't know about and that the tech didn't know about. So now they're prioritizing the things that have been delegated to them, and your task gets bumped down on the list, but you don't know because you didn't close that loop. You didn't follow up. You didn't continue to make sure that those tasks were getting done. So I hope this has been helpful to you to know when to delegate, how to delegate correctly, and to be more clear as to what can be delegated. And just realize that delegation doesn't mean that you're lazy. It doesn't mean that you're not a good nurse, but it does mean that it will support the team in growing and it will keep your license and your patients safe. It's also not just managing workload. And like I said, don't be dumping tasks. Also, last tip, I'll just add this in as a bonus. Don't be delegating just to avoid discomfort. If it's uncomfortable for you to wipe a patient's butt still, and you're delegating it because you're uncomfortable, not because you're available and capable, then that is not okay either. That's something to talk with your mentor about to support you in growing your comfort level and your confidence with those uncomfortable tasks. So just know that in a hospital setting, tasks can be messy, they can be emotional, they can be challenging. This is all part of nursing, but don't push something off or hide that you need help just because of your discomfort. Remember, start small, build that confidence with each ask, and use delegation as a tool to improve patient care. Because you got this and you do have an RN by your name, and there are only things that you can do for the patient, and they hire support staff for a reason. So don't hesitate to use those that are there to serve your patients and to help the flow of care go easier. I hope this was in service, and I can't wait until the next perfect time. Much love.